The Bainhams created a wonderful, wonderful family institution. I mean, I work with family. I consider my coworkers to be like family, and I consider the residents to be like family.
People smiling at you all the time. They're always saying hello. It's a very warm feeling. Doesn't give the impression of a nursing home.
And then, of course, the staff is wonderful too. They really do take care of us.
I mean, they're enthusiastic. They're not just droning through a job. They have smiles. I think it's a requirement to work there.
We set up a system of patient living, and that recognized that the nursing care would maybe take 4 or 5 hours a day, and then they had all this other time left. And we wanted to enrich that with an activities program and with visitors and interaction.
It is very family-like. The Bainhams, of course, is a family. This is run by, their children.
Families, when they come in, they say they feel the atmosphere right away.
I didn't feel like I was in an institution. I felt very much at home and very safe. They did treat us like family and friends. I mean, many of them want to stay in contact.
Initially, it's all about education because so many families, this is the first time that their loved ones have needed a facility like ours. So there's lots of questions, there's lots of concerns. Are there going to be enough nurses? Are there going to be enough aides to take care of their loved ones?
They probably have about 250 staff just in the nursing department.
We strive to have the highest staffing to patient ratio, and I think we meet it.
When I go to other nurses' meetings, they're in awe of all the staffing that we do have.
The people there really cared about the patients.
When I have toured family members, is that, what you need to look at is look at the patients, look at the staff. Are they smiling? Are the patients smiling?
Our senior administrator and our director of nurses, they both have a card with their cell phone numbers on it, home phone numbers, so that if a family isn't getting the response they need, they can call 24 hours a day and solve something immediately.
One of the key factors that our HR department and the different departments that hire look for is compassion.
When I am touring a new candidate that I might think I might hire, is while I'm taking her through all the units, I watch and see how she interacts with the residents.
The technology at the nursing home helps the staff do their job more effectively and efficiently.
So now we have a system that logs in when a patient's call bell goes off. And if it goes past the 15 minutes, it goes to my house and my phone or my director of nurses' phone.
The nursing department that has a system called Care Tracker where they can do daily activities of daily living charting right as they do their job, so it's fresh in their mind and they just walk down the hall and they chart it quickly on a kiosk that's mounted on the walls. It provides better care and a better assessment for the residents. When you first come up to the nursing center, you'll notice it's quite deceiving, and the property that it's on, is a steep hill. It's an incline, so you're actually entering through the front door on the 3rd floor of the nursing center. And each floor is divided into approximately a 50-bed unit to make up a 200-bed nursing facility. Dining rooms on every floor. We encourage the residents to come out each day and eat in the dining room. You'll notice also that each floor has bright, cheerful sunrooms for visiting. When families come, these rooms are reserved for parties or just for visiting each day. There's a large sunroom with a patio on the 1st floor that you wouldn't even know was there when you're entering up on the 3rd floor. It's beautiful, toys and games and swing sets for visiting grandchildren. There's a large koi pond. There's numerous tables and gazebos and walking paths. There's a 50-bed secured dementia unit that also has outdoor secure space patio, so those residents can still go outside safely. We have 2 rehab gyms, rehab suites. They both have a full functioning kitchen set up exactly the same as a home kitchen to be used as an OT and occupational therapy space. If a resident needs to relearn those skills, we have stoves, microwaves, refrigerators, sinks, countertops, cabinets. We have a rehab bedroom, a rehab bathroom with shower, so residents that need to relearn those skills as well so that they can go home from the nursing home, which the majority of our residents do go home after their skilled care in our therapy department.
Well, many years ago, my parents have and still have a philosophy to staff richer than other places do. And, to have like a massage therapist on staff at the nursing home, to have a chaplain that will go between all 3 facilities.
The fact that the Bainham Healthcare family has had me as a full-time chaplain for 16 years shows that they are very concerned about the spiritual life of our families. A very important part of the recovery process.
Mr. Bainham is very innovative. Many years ago, in the early 70s, I guess, he decided he was going to take people out to D.C. sightsee. And that was unheard of at that time. But up pulls a Greyhound bus, and we carried those people up those steps.
Most nursing homes don't want the needy patients sitting near the nurse's station. That they shouldn't be just put in their room. They should be out there getting the stimulation at the nursing station.
A lot of residents don't really want to stay in their room when they go to a nursing home. They want to be out. They want to be, I've used the analogy that it's their front porch. It's where all the commotion is, and where are you at home, but you're sitting on your front porch and you're watching everything happen.
Some of the unique challenges that we have at Fairfax Nursing Center in the dining operations are the different meals that we need to prepare per resident. So it's a very focused meal preparation given the condition of the residents that we have. The kitchen does a great job, they're organized, and they really take the time to make sure they get the meal per patient correct every time.
The dining room is always very, very nice. They have tablecloths on the table and flowers, and the food has been very, very good. We've eaten several holiday dinners at the nursing center.
We do have certified nursing assistants that are present that help get the residents set up for their meal period. They assist them when it comes to dining with beverage service or helping with their food, handling utensils and items like that.
It's not people's first choice to be in a nursing home or an assisted living. However, if you're going to be there, we want it to make that time the very best it can be.
Robert and Charmaine Bainham are on property. They're present, they're visible, they're accessible, they care a lot. And that really carries through on the staff we look for, that we hire, that we have high expectations, and our focus is on customer service.
We like people, and we like to do what we can for their comfort
and for their safety.
It's very individualized care there. It's not just everybody's treated the same, because each resident is different, each resident's family is different.
One thing that swayed us almost instantly was Lexi met us at the door. And I said, this has got to be a cool place with dogs and cats running around.
The nursing home is a very busy place, which is a great thing because it actually means that the families and visitors of the residents are coming in and visiting them. So if we have 200 residents, there are days where we probably have 100 to 150 visitors in the building.
I never heard at the nursing center anyone who acted impatient or spoke shortly or acted like they were in a hurry. The only thing I saw was kindness and caring at Fairfax Center. Now, he was very sick and he required a lot of care, but nobody ever acted like this was more than they felt like doing.
Around the dinner table, I remember for years, and we still do it today, that we would talk business. And it seems like we were always interested in how to make the places that we were working at better.
The Bainhams are always interested in what we're doing. They'll ask about, do we have any problems, any family issues, something they can help with. They always ask, do we have the right amount of equipment? Do we have what we need to take care of the residents? And if we don't, they provide it for us quite quickly.
When we walked in, I said, it does not smell like our memories of what a nursing home is. And I have to say, as silly as it is, I got in the elevator and it had wallpaper and paintings in the elevator. And I said, there's enormous attention to detail here.
A couple of years ago on our Alzheimer's unit, there was a family member who every day he would come and visit his wife that was in our nursing home. And he just stopped coming. And the staff made calls, couldn't get a hold of him. They were concerned. 2 nurses got in their car, drove to the man's house. He was passed out in his house. They got the, called 911, got the authorities there, and saved his life. That is an example of staff caring about not only the resident, but they care about the family that is there with them.